Regenerative medicine is really state-of-the-art technology that we're using here, which includes predominantly adult stem cell therapy and platelet-rich plasma therapy to help patients that traditional non-operative treatments were unsuccessful. We've been utilizing those procedures and just getting tremendous results in helping people decrease their pain levels, improve their function, and live life on their terms.
The problem with chronic injuries, such as osteoarthritis or meniscus tears, is that the body doesn't try to heal it anymore after a certain amount of time, and it accepts the injury. Regenerative medicine is a way to take those cells, place it directly into that area to promote the healing capacity of the body. I've had the pleasure of working with several professional athletes who, beat up their bodies and have a lot of injuries secondary to years of playing in the NFL. They've been able to maintain, and I think that's important, maintain their function. Yes, we're not going to make dramatic changes necessarily to their pain levels, but if we can help maintain their current function, I think that's a great outcome.
Performance rehabilitation provides kind of this proactive form of medicine with its stem cell procedures, and that able to go into joints and help, just with needles as opposed to scalpels, and be able to input, the stem cells in areas that need repair, and then you let the body naturally do what it's capable of doing, and that's able to help create that resurfacing and that reconditioning, that repair that is necessary to help the joint perform better.
I'm 57 years old right now, and when I was 50, I really hit a wall because my body chemistry changed. I've been living very comfortably the last couple of years, thank God, with all these things that have that I've been working on with the PT and the PRP and the stem cells. My body feels as good as it has probably since I went to college at 18 years old.
I came in here with an inability to really be functional in a gym any longer. And I was getting nervous because I noticed that my strength was decreasing as opposed to increasing. We started with some rehabilitation, and they started to get the ligaments and the joints and the muscles around my shoulder in better operating shape. And then we started with our first stem cell procedure. And sure enough, maybe after 2 weeks, I was back in the gym again, starting to work on my usual workouts. And then another month later, they did my right shoulder, and I had the stem cells and the PRPs there. And it's been 6 months since then. And what I can tell you is I'm 150% better. The day-to-day pain is gone, which I'm blown away with. There still is some discomfort, but nothing that I can't live with.
The results from the stem cell treatments have been positive. I've seen a noticeable improvement in my left knee where I had the procedure done, that there's not as much stiffness in the knee, not as much pain.
My knees, I didn't have tremendous problems with my knees. I can feel there's that little aches and pains, they've gone away. The professionalism and there's just something a little different about this place than any other place. You can just feel, it can kind of feel the spirit a little bit. Not a little bit, a lot.
The collaborative effort of performance rehabilitation and regenerative medicine, it is a unique structure in our specialty. There are facilities who are doing this by just injecting the materials and not really following up on a comprehensive rehabilitation program. I think what sets us apart is that we do focus on regenerative medicine and rehabilitation at the same time, because we're stimulating the body to heal, but at the same time you do have to focus on the muscles and the ligaments and strengthen an area that is weak.
Since we're a multi-specialty office, which includes sports medicine physicians, chiropractors, massage therapists, physical therapists, acupuncturists, we have to work in a highly collaborative environment. Once again, going back to, we all believe that we could do more collectively for that patient than any one of us could do individually. So the collaboration value is just a central part of why we believe that, and we've experienced that, we get patients better faster in a interdisciplinary collaborative environment.